Today we are going to be looking at a health disorder called hemophilians. Hemophilians is a health disorder where an inherited bleeding disorder where the blood does not clot properly, causing prolonged or excessive bleeding after injury or even spontaneously. This occurs due to some deficiency in protein in the blood, causing dysfunction of clotting factors. So there is two major causes of this chronic disease called hemophilians. Number one is inherited genetic factors. Inherited genetic factors. In this case, people are born with this disease called hemophilians from their parents, maybe from they are born from maybe their parents or one of the generation suffer it from the parents, and they can be transferable to their young ones. The second one is acquired hemophilians. In this case, people get it as long as or it can be developed later in the life after their immune system attack their own clotting factors. This is associated with the factors like age or childbirth. This factor is associated with age and childbirth. So, what are the symptoms of this hemophilians? What are the symptoms of this hemophilian? Number one symptoms is easy or excessive bruising. Easy or excessive bruising. When something happened to you maybe something hit you in the leg, the bruises will be there for a long time without healing. Or when you injure yourself and the blood coming out there is continuously without stopping, without clotting, and the injury will be there for a long time. These are the signs of hemophilians. The number three signs of hemophilians is gums or nose bleeding that are difficult to stop. Gums or nose bleeding that are difficult to stop are signs of hemophilians. The fourth one is blood in the urine or in the stool. When you urinate, there is blood in your urine, or when you go to toilet and what you discharge out your stool, there is blood inside. It is signs of hemophilians. The the last and not the least is swelling or pains or tightness in joint, especially from bleeding into the joint space. These are signs of hemophilians. Bleeding in the brain, which can be life-threatening and causes headache, vomiting, and seizure, are all symptoms of hemophilians. They are all symptoms of hemophilians. So, having know the meaning of hemophilian, the causes, and the symptoms, let's see the inheritance or who is affected in this topic of hemophilians. Hemophilians is an X-linked recession, meaning it is passed down on the X chromosomes. It is passed down on the X chromosomes. So having us mention X chromosome, Y chromosome, some people may not know what we are talking about. X chromosomes are cells that formulate male child, while the Y chromosomes are the cell that formulate female child. So these hemophilians are always found between the male, between the male. So because they contain and or they this particular sickness is engaged with the X chromosomes, which are linked to the male cells. So the male child or male are the most people that suffer this sickness the most. It's mostly affects the male because they have only one X chromosome. So if it is carriers of the methylated gene, there we have the disorder. There we have the disorder because it's only engaged on these male cells. Women also can also have this hemophilian because but they are rare in the female cells. They are rare, but it needs to inherit the methylated gene on both our X chromosome to be affected. So, for a woman to inherit this sickness, that woman must have the S and the Y chromosomes that is affected for it to manifest. So, having known the inheritance and who this sickness is being affected mostly, let's look at the diagnosis and treatment. What could be the diagnosis and the treatment of this chronic disease called hemophilians? Number one is diagnosis involve applying exams, a review of medical and family history, and blood tests to check for clotting factors level. Need a diagnosis that involve a physical exam, a review of medical and family history. This is how to treat this sickness called hemophilians. Number two is newer treatment like gene therapy are also available and can help prevent or eradicate bleeding. This new therapy, which uses gene therapy. It is using gene therapy, the gene that can be used to fight this sickness, this disease, are being used as a factors in treatment of this disease called hemophilians. The third and not the least is treatment varies depending on the severity, but often involve replacing the missing clotting factors through infusion. So just like the treatment of these hemophilians varies, but still replacing the missing clotting factors through infusion. So this sickness can use some factors that can fight against this sickness as treatment. You can use the factor to fight this sickness as treatment, especially when you see that the person lacks protein in the body, which is being used to rebuild the damaged cells. The protein can be recommended for the patient for easy healing and total treatment for this sickness. Thank you for watching. Like this video and share it for people to get notice of these hemophilians, that you are having injury in your body that has refused to heal, or you are having bleeding continuously, Know that it is not ordinary. Know that something is involved. Know that those are symptoms of hemophilians. Thank you. Watch over while the other ones, my other videos will come over. Like and share while I get you updated in my next video. Thank you.